Hello, my name is Claudia Guevara. This is my partner Vianney Delgado, and our presentation today is over schizophrenia.
Going off of our current knowledge on schizophrenia, according to Jim Van Oss and Kshitij Kapoor, there are many causes to schizophrenia, such as prenatal and early childhood factors. There's the environmental factors as far as like your surroundings, the way you grow up and the things that surround you. The interplay between genes and the environment, so meaning if you have schizophrenia in your family and then the way that that connects to the environment around you, and overall the many different genes that come together to possibly cause schizophrenia, and the effect of a traumatic event happening to a person.
Our knowledge continued. According to Michael J. Owen, the drugs that are used to treat this illness are actually hurting the patients instead of helping them. They cause high cholesterol, risk of diabetes, and a lot of other things. So,
now the significance of the investigation. The purpose of doing this is to help the doctors and improve the treatment of medication. Those kind of go hand in hand as far as the doctors are going to have more knowledge on the subject, and therefore they can better their treatment and the medication so that it's not causing so much harm to the patients. By doing so, it will also help the patients and the families have a better understanding on the illness, and overall just better educate society.
trauma and schizophrenia evolution. Does the exposure to trauma have an impact to the speed that the illness progresses? When a traumatic event collides with the different genes in a person, there will be a significant increase in the speed that the disease progresses.
Now, this is going to be our focus. We are going to focus on trauma and the genes. After we went over the many causes, this is kind of where our interests lay. So this is kind of what we decided to go more into. Here we have our research question about the exposure, and then we have our hypothesis.
Methodology. It's going to be a 2 to 3 year study. We're going to analyze the exposure to trauma between people with the gene potential in comparison to the people without, of course. The patient will already be diagnosed because it runs in the family. You know, they have that gene, and the mentality changes. It changes in neuroimaging.
Now, looking at this over the 2 to 3 year study, this is kind of like what we're going to be analyzing. Within looking at our patients, we're going to see, okay, how much did their mentality change using MRI scans. We're going to see if you can see noticeable changes between the neuroimaging within the years and over the course of our study. Now, the responsibilities that we have to look at the Belmont report and look into the respect for persons, the autonomous agents. That really describes our patients because they do have the right and the freedom to make decisions. But because we're dealing with people with a disease, there are going to be some with a weakened autonomy, and therefore we have to kind of change our rules for them, and they need to be protected. And by doing that, we would have to notify the next of kin in order to make sure that those people who aren't able to make decisions on their own are taken care of just as well.
Impacts. Of course, it's going to impact scholars, hopefully help them make new medications and treatments and help them progress in this study. And the community is going to help individuals struggling with this disease have a better understanding, allows them to cope better, and society as a whole. Overall, the better understanding and to better educate society about this illness.
Thank you.
Any questions?